Introducing the HAE Me mobile app. At Pharming, we understand that helping your patients track and manage their hereditary angioedema is an important part of your job. So our app is available to all of your HAE patients. Here, all your patients will have tools and resources for tracking HAE swells, enabling them to better share their HAE swell history with their healthcare team. This includes tracking swells and accessing valuable HAE information such as resources, videos, storage of medical documents and lab results, and even learn about upcoming HAE events. If they are a Ruconest patient, they'll also receive prescription refill reminders. All patients will also get a weekly inspirational quote on the home page when they log into the app. Now let's log in and check it out. First, when they open the app, they will set up their accounts and select their HAE medicines. At this step, the app is personalized for Ruconest patients and connects them with their individual Ruconest patient advocate, RPA nurse. Patients on other therapies have access to all the other resources in the app. This is the home screen. Here they'll find an inspirational quote and quick access to the Swell logging feature and the video library. On the top left, there is a menu drop-down to help navigate the app. The first section is Understanding HAE. Here your patients will find a library of information. They can learn more about what HAE is, what causes it, and hear about signs and triggers of a swell. The My Swell Tracker allows your patients to track their swells and create reports so they can accurately share what they've experienced with you at their next HAE visit. Here's how it works. They start by entering the date the swell happened. Next, they will list all the signs and symptoms they experienced. They can rank how severe the swell was, whether or not something triggered the swell, how much time has passed since the first signs of their swell and taking their medication, what medications they use to treat the swell, if any, and if they needed to retreat their swell. If they are 18 years or older, they can upload photos of the swell. After logging their swell, they will have access to an overview of everything they inputted. Once they have a few entries, the app will compile the data and show charts revealing their swell trends. They can select a time frame of 3 days, 3 months, 6 months, or 1 year, and email themselves a copy of the report. The emailed report also includes a calendar report and a summary of each swell logged for the chosen date range. They can take this report to their next visit with you, their HCP specialist, and have a detailed discussion about how well their disease is being managed and how many swells they've been having. For the Ruconest patients, there is a section called My RPA. My RPA is where your patients can find out who their Ruconest patient advocate nurse is, see a picture, and get their contact information. This is also where they can request a live training or for their RPA to contact them. My Important Documents provides your patients a place to upload letters from their doctor about their HAE diagnosis, their HAE lab values, and their doctor's information. This is a convenient location to keep their documents in the event they might be traveling or have an emergency and need to explain HAE to emergency care personnel. Resources and Support gives your patients access to several resources about HAE, such as Living with HAE, Ruconest Training, Ruconest Solutions, My Inspiration Bank, a video library, and HAE programs and events. In the My Profile section, patients can set up their profile page by uploading a photo, filling in personal information, and listing their medications. There is also a convenient prescription refill reminder. The HAE Me app also rewards your patients for their time and effort through the badge program. For example, the more times they log a swell, read about HAE, or watch videos, the more badges they will receive. The HAE Me app can provide your patients with tools and resources for tracking HAE swells, enabling them to better share their HAE swell history and share what they've documented with you. They can do all this and receive an inspirational quote each week. If you haven't already, encourage your patients to download the HAE Me app today. Indication: Ruconest is indicated for the treatment of acute attacks in adult and adolescent patients with hereditary angioedema, HAE. Effectiveness in clinical studies was not established in HAE patients with laryngeal attacks. Important safety information. Ruconest is contraindicated in patients with a history of allergy to rabbits or rabbit-derived products, and for patients with a history of life-threatening immediate hypersensitivity reactions, including anaphylaxis to C1 esterase inhibitor C1-INH preparations. Monitor patients for early signs of allergic or hypersensitivity reactions, including hives, generalized urticaria, tightness of the chest, wheezing, hypotension, and/or anaphylaxis. Should symptoms occur, discontinue Ruconest and administer appropriate treatment. Serious arterial and venous thromboembolic (TE) events have been reported at the recommended dose of plasma-derived C1-INH products. Risk factors may include the presence of an indwelling venous catheter access device, prior history of thrombosis, underlying atherosclerosis, use of oral contraceptives or certain androgens, morbid obesity, and immobility. Monitor patients with known risk factors for TE events during and after Ruconest administration. Appropriately trained patients may self-administer Ruconest upon recognition of an HAE attack. Advise patients to seek medical attention if progress of any attack makes them unable to properly prepare or administer dose of Ruconest. The serious adverse reaction reported in clinical trials was anaphylaxis. The most common adverse reactions, incidence of greater than or equal to 2%, were headache, nausea, and diarrhea. Before prescribing Ruconest, please read the full prescribing information at www.ruconest.com/PI.